attempt to fight a wave of inoculation fatigue that some countries are witnessing. With Europe opening up, some politicians are cautioning that different rules based on immunisation status is the only safe way to motivate those hesitant to get the jab. Private groups, like the organisation set up by former UK Prime Minister Tony Blair, are pushing for governments to have a stricter approach.
I just think we've got to be careful as we open up. COVID's not over. We're going to have to live with COVID for a long time to come. The key thing is to draw a clear distinction between people who are vaccinated and people who aren't.
Meanwhile, German Chancellor Angela Merkel has ruled out mandatory vaccines. She hopes more people will choose freely to get the jab so life can continue returning to normal across Europe.
And for more now, I want to bring in healthcare analyst Dr. John Campbell. He joins me tonight from Carlisle in the UK. Dr. Campbell, it's good to see you again. Let's start with France and Greece. They are making coronavirus vaccinations mandatory for all healthcare workers. Talk to me about why this is necessary.
Well, because these patients are at risk and healthcare workers can pass the virus on to their patients. And we now know quite definitively from data in the UK that people that are vaccinated are 50% less likely to get the virus in the first place. And if they do get it, they're 50% less likely to pass it on. So we're talking about a 75% level of protection here. So there's a pretty good medical rationale for this.
Is there an ethical rationale for not making the vaccines compulsory? I'm thinking of the German Chancellor Angela Merkel. She says that there's no need right now to make the vaccinations mandatory.
This is a good debate, and of course, and you'll get lots of different opinions from different ethicists. It's a fundamental principle in healthcare that we must give informed consent for everything that we do. So I can't even take a patient's blood pressure without their informed consent that they allow me to do that. So it's perfectly reasonable that everyone has the choice what medications or vaccines they get. That's a basic human right. But there again, employers have a duty of care. They have a duty of care to their employers, who they have to maintain health of, and they also have a duty of care towards the patients for whom their employees are looking after. So it's balancing this risk between informed consent and the duty of care that employers and individual clinicians have. And of course, Hippocrates, the first doctor who's documented, said first do no harm. So it is incumbent on all healthcare workers not to do harm.
There's a lot of talk right now, too, about whether or not societies will reach herd immunity. Is it even realistic to have that as a goal at this point, considering that there is vaccine hesitancy as well?
There's not enough people getting vaccinated generally in the world, but very often this is due to lack of vaccine supply. And as this is increased, then the level of immunity due to vaccinations will also increase. And especially in the UK at the moment, as you've probably heard, we're going to have these release of the legal restrictions. There's going to be a lot more cases. Cases in the UK could well go up to 100,000 per day. That is not impossible. And that means a lot of people are going to be exposed to the virus. So there's going to be a lot more natural immunity. And people that have been vaccinated, when they're exposed to the virus, being exposed to the virus will give them an extra booster of immunity as well, as if they've got a booster dose of vaccine. So overall immunity, community immunity, herd immunity, if you want to call it that, is increasing, but we're not there yet. It's probably going to be around about the 95% mark because this Delta variant is so transmissible.
We know that Pfizer and BioNTech are developing what they say is a booster vaccine that could protect against the Delta variant. The FDA in the United States says it's too early to say that they're needed. But do you think it's inevitable that we are all going to need booster shots?
I think there's two questions there. One is how long will the immunity last for? Now, the early indicators from the Oxford type vaccine, the AstraZeneca vaccine, and from the Pfizer Moderna type vaccines, is that the immunity so far seems to be lasting for a long period of time. And I'm hopeful it's going to last for a year or several years. So there's that. But then we might need to give vaccines that are more specific to particular variants, these so-called tweaked vaccines. So these companies are now working on a more specific vaccine. And the plan in the UK is to give a third dose to people over the age of 50 or 60, we haven't decided yet, who are or people that are more clinically vulnerable in the autumn. But this is going to be a dose of what you might call the old-fashioned vaccine. So 3 doses of the old-fashioned vaccine is going to increase immunity against new variants to some degree, while we wait for these more tweaked vaccines. And it may be that we end up needing a booster vaccine that's specific to the particular variants that are around that year every year for the next few seasons. That is certainly a possibility and is being actively planned for in the UK.
Yeah. An end in sight certainly is not the case, that is for sure. Dr. John Campbell, as always, Dr. Campbell, we appreciate your time and your insights tonight. Thank you.
Thank you, Brennan.